Hey, it's Adam Sewell, MD. Welcome to Section 3.5 of the Microplastics Toxicity Training, certified by the Microplastics Health Alliance. Today, we're going to focus on an emerging and increasingly concerning dimension of microplastic toxicity, the neurological effects. We'll cover how microplastics may affect brain development, influence mood and cognition, and potentially play a role in neurodegenerative conditions. We'll also take a deep dive into the immunohistochemical evidence from preclinical studies and explore the mechanisms that may be driving these effects. Part 1. Can microplastics reach the brain? First, let's address the foundational question. Can microplastics cross the blood-brain barrier? The answer, according to several recent preclinical studies, is yes, particularly for nanoplastics under 100 nanometers. A study by Liang et al. 2021 showed that orally administered mixtures of polystyrene nanoplastics 50 nanometers and microplastics 500 nanometers induced reactive oxygen species-mediated apoptosis in the intestinal epithelium, increasing permeability and enabling systemic translocation, including to the brain. Later investigations 2022 to 2024 confirmed that polystyrene nanoplastics can cross the blood-brain barrier, activate microglia, and accumulate in brain regions such as the hippocampus and prefrontal cortex, disrupting neuronal structure and function. Further support comes from a 2020 study in particle and fiber toxicology, where researchers observed that polystyrene nanoparticles not only accumulated in the brain but also triggered oxidative stress and neuroinflammation, leading to impaired spatial learning and memory performance. Part 2. Mechanisms of neurotoxicity. So how do these particles cause damage? There are three major mechanisms: oxidative stress, neuroinflammation, and disruption of neurotransmitter signaling. Oxidative stress. Microplastics increase the production of reactive oxygen species, ROS, in neuronal cells. Excess ROS damages mitochondrial DNA, disrupts ATP production, and initiates lipid peroxidation, especially in the highly fatty tissues of the brain. Studies using DCFHDA assays in neuron cultures show significant ROS elevation within 24 hours of nanoplastic exposure. Neuroinflammation. Perhaps more concerning is the activation of microglia, the brain's resident immune cells. When exposed to polystyrene nanoplastics, microglia upregulate expression of inflammatory mediators like interleukin-6, tumor necrosis factor alpha, and interleukin-1 beta. Immunohistochemical staining shows increased Iba1 expression, an established microglial activation marker, alongside elevated glial fibrillary acidic protein in astrocytes, indicating widespread gliosis. This glial activation is not benign. Chronic neuroinflammation is a well-documented contributor to neurodegenerative conditions, including Alzheimer's, Parkinson's, and multiple sclerosis. Even without overt disease, neuroinflammation impairs synaptic pruning, neurogenesis, and myelination, processes critical to healthy brain function. Neurotransmitter disruption. Microplastics and their associated plasticizers may interfere with dopamine, serotonin, and acetylcholine pathways. In zebrafish models exposed to polystyrene nanoplastics, researchers documented reduced levels of dopamine and serotonin in the brain, alongside altered behavior patterns, specifically increased anxiety and reduced social interaction. Tyrosine hydroxylase, a key enzyme in dopamine synthesis, showed downregulated expression on immunostaining, while synaptophysin, a synaptic vesicle marker, was also significantly reduced. Part 3. Effects on brain development. Let's talk about development. The developing brain is exquisitely vulnerable to disruption from environmental toxins, and microplastics are no exception. A 2024 study published in the Journal of Nanobiotechnology investigated the effects of maternal exposure to polystyrene nanoplastics, PSNPs, on the neurodevelopment of rat offspring. The pups showed lower birth weights, delayed motor skills, and reduced spatial learning capacity in maze trials. Immunohistochemically, there was reduced expression of brain-derived neurotrophic factor, or BDNF, in the hippocampus, as well as decreased Neuin, an established neuronal nuclei marker, suggesting impaired neuronal maturation. In human observational data, although we don't yet have direct evidence of microplastics in fetal brain tissue, we do have mounting concern. A 2021 study out of Italy confirmed microplastics in human placentas, including in the villus stroma and choriamniotic membranes, indicating that particles small enough to reach the fetus are being delivered in utero. Given that endocrine-disrupting compounds associated with microplastics, like BPA and phthalates, are known to impair fetal brain development, the convergence of these pathways could represent a silent neurotoxicity risk across the population. Part 4. Behavioral and cognitive outcomes. So, what clinical effects might we see in humans? While human studies are still emerging, we can extrapolate cautiously from existing animal models and preliminary population data. In children and adolescents, potential associations include lower IQ scores linked to prenatal EDC exposure, increased rates of ADHD and executive dysfunction, language and processing speed delays, sleep disturbance, and mood dysregulation. In adults, reported symptoms may include persistent brain fog and decreased focus, early signs of cognitive decline or mild memory loss, mood disturbances including anxiety, irritability, and depressive symptoms, sensory processing changes, for example, light or sound sensitivity. The 2013 Taiwan Environmental Survey for Toxicants measured urinary BPA and substitutes BPS-BPF in 271 adults, finding median BPA levels of 9.63 micrograms per gram creatinine, with 99% of participants exceeding EFSA's updated TDI thresholds. Concurrently, several studies across animals, children, and adults have linked higher urinary BPA and phthalate metabolite levels with poorer working memory and executive function, even after adjusting for age and comorbidities. Part 5. Immunohistochemical and laboratory markers of brain involvement. Let's pause and discuss what we're seeing on the tissue level. Immunohistochemistry provides powerful visual confirmation of how microplastics are affecting the brain. Markers of inflammation: ionized calcium-binding adapter molecule 1, microglial activation, glial fibrillary acidic protein, astrocyte reactivity, interleukin-6, tumor necrosis factor, alpha, pro-inflammatory cytokines. Markers of neuronal damage: neuronal nuclei, decreased expression in hippocampus and cortex, caspase-3, increased apoptosis in cortical neurons, brain-derived neurotrophic factor, reduced expression, especially in developmental models, oxidative stress markers, 8-hydroxy-2-deoxyguanosine, marker of DNA oxidation, inducible nitric oxide synthase, linked to neuroinflammatory stress, superoxide dismutase, 1. Altered expression in response to oxidative load. Together, these data points form a consistent picture. Microplastic exposure leads to neuroinflammation, oxidative stress, synaptic damage, and altered neurotransmitter signaling. These changes don't occur in isolation, they're intertwined and cumulative, meaning that chronic low-level exposure over time can quietly degrade neurological resilience. To summarize, microplastics, especially nanoplastics, can reach the brain. Once there, they can cause oxidative stress, neuroinflammation, and interfere with neurotransmitter signaling and neurodevelopment. These effects are being confirmed in preclinical models, and we are beginning to see the earliest signals in human population studies. As physicians, we must begin to include environmental toxin exposure in our neurologic assessments, especially for patients with unexplained cognitive symptoms, developmental delays in children, and neuroinflammatory conditions. While there's no standard clinical test yet to detect microplastics in brain tissue, we can look for patterns, inflammatory labs, symptom clusters, and known sources of exposure. In our next and final section of Module 3, we'll discuss the challenges in measuring total microplastic burden in the human body, and what tools we have, or may soon have, to estimate and reduce that burden in clinical practice. Thanks for joining me. I'll see you in Section 3.6.